Hello there. Let's speak about endoscopic sleeve gastroplasty, ESG, which gains momentum in obesity treatment nowadays. 1 in 6 adults in Europe now lives with obesity, placing them an increased risk of type 2 diabetes, cardiovascular disease, and certain cancers. According to the World Health Organization, 1 in 8 people globally is affected by obesity. As obesity rates rise, the use of various treatment approaches, including medications originally developed for diabetes, is also increasing. Across Europe, there are significant disparities in the clinical indications, utilization, and funding of bariatric surgery. For example, the UK is among the countries with the lowest rates of bariatric surgery, despite obesity-related healthcare costs reaching £6.5 billion annually for the National Health Service (NHS). Now a growing number of obesity societies officially endorse endoscopic sleeve gastroplasty (ESG) as a treatment option. So what is ESG? ESG is a minimally invasive procedure that reduces the size of your stomach by placing internal sutures via an endoscope without any external incisions, any surgery. International recognition and evidence growing. The International Federation for the Surgery of Obesity and Metabolic Disorders, IFSO, reviewed 44 studies involving over 15,000 ESG procedures performed using the Boston Scientific Overstitch system. Following this systematic review and meta-analysis, which is very important for scientifically, IFSO recognized ESG as an effective, safe, and cost-efficient treatment for obesity. According to IFSO, patients with class 1 and class 2 obesity, as well as selected class 3 patients who are not suitable candidates for bariatric surgery, can benefit from ESG. The Federation states that ESG provides significant weight loss with a favorable safety profile and a low rate of serious complications. There is a rising national level support for ESG. Recognition from SOFCOM France. In February, the French Society for Bariatric Surgery released a position statement and guidelines acknowledging ESG as more effective than lifestyle changes alone. The Society also considers ESG a key component of the therapeutic arsenal for bariatric and metabolic surgeons. SOFCOM recommends that ESG be performed in accredited centers by a multidisciplinary team with careful patient selection. Also, GYRO's guidelines from Spain. Spain's Obesity Society, CEDO, published the GYRO guidelines recognizing obesity as a multifactorial chronic disease and recommending ESG as part of a multidisciplinary treatment approach. The guide highlights ESG's high tolerability and low complication rate due to its minimally invasive nature, with improved clinical outcomes observed with repeated procedures. Technological advancements also helps us. Boston Scientific manufactures minimally invasive medical devices, such as the Overstitch endoscopic suturing device used for ESG, and this system utilizes a thin, flexible tube inserted via the mouth to stitch the stomach wall, reducing its volume by 70% and inducing a sense of fullness. The latest Overstitch NXT system improves control during the procedure by enhancing the device's flexibility. This allows clinicians to perform the procedure more independently. Designed to work with single-channel gastroscopes, the Overstitch NXT is compatible with multiple models. Studies show the patients typically return to their normal daily activities just 3 days after ESG. Also, NICE endorses ESG in the UK. The UK's National Institute for Health and Care Excellence, NICE, has published guidance supporting ESG. Due to its shorter hospital stays, lower risk of complications, and reduced likelihood of readmissions, ESG is expected to ease pressure on the healthcare system. With appropriate training and support, ESG can be performed as a day case procedure by endoscopists or surgeons. Currently, around 30 centers across the UK, both NHS and private, offer ESG. Training and implementation support is very important. Boston Scientific has launched a comprehensive training program for ESG and similar procedures in the UK. Darlington Memorial Hospital in County Durham was among the first centers to complete the training. Remote guidance was provided via live video links during subsequent ESG cases. Inclusion in NICE Clinical Knowledge Summary, CKS, very important. NICE has incorporated ESG into its Clinical Knowledge Summary for general practitioners, nurses, and pharmacists. According to the update, ESG is suitable for patients with a BMI of 35 or more who are at high surgical risk, as well as for individuals with a BMI in between 30 and 35 and under risk of disease progression. The increased awareness and use of ESG by primary care professionals could lead to better long-term patient outcomes. However, limitations such as the lack of operating theatre capacity may hinder wider adoption. In conclusion, ESG offers a viable alternative for healthcare systems. Patients today have multiple options for weight loss, medications, bariatric surgery, and ESG. According to leading scientific bodies, ESG is not only an effective weight loss intervention, but also a strategy to reduce the burden on healthcare systems. Wider adoption of medical technologies like ESG requires systemic reform and investment. Thank you for listening.